Hi, David Rosenberg here for the Psychopharmacology Institute. In this CAP, or Child and Adolescent Psychiatry Smart Take, we'll take a close look at depression and anxiety in remitted adolescents and young adults and the effectiveness or lack thereof of relapse prevention strategies on risk of and time to relapse. Relapse rates for youth with major depressive disorder are extraordinarily high and range from almost 50% to nearly 70% over 6 months to 2-year follow-up and over 70% over 15-year follow-up. Anxiety and depression in youth are robust predictors of depression and anxiety in adulthood. Depression and anxiety are frequently comorbid, and each increases the risk of the other. That being said, there's been surprisingly little focus on effective relapse prevention strategies for youth with these disorders who are in remission. The most common relapse prevention interventions used for depressive and anxiety disorder in youth are antidepressant medication, continuation, psychological interventions such as cognitive behavioral therapy, or combining cognitive behavioral therapy or other psychotherapies with antidepressant treatment. The authors here conduct the very first meta-analysis and systematic review examining relapse strategies which included antidepressant continuation, psychological interventions or their combination for youth 13 to 25 years of age in remission of major depressive disorder or anxiety disorders, and compared them for youth in remission to control conditions for relapse rate, time to relapse, and depressive and anxiety symptoms. So what did they find? Well, there were 9 randomized controlled trials for youth with major depressive disorder, but no randomized controlled trials for anxiety relapse were identified. Not one, 0. For depression relapse, CBT-based psychological treatment alone or combined with antidepressant continuation resulted in relapse being half as likely, time to relapse being longer, and depressive symptoms being significantly lower at the last follow-up compared with the controlled conditions such as treatment as usual, pill placebo, or no antidepressant continuation. That being said, relapse rates were still very high in both the control conditions as well as CBT alone or in combination with antidepressant continuation. So relapse rates with CBT alone were 52%, and CBT with antidepressant continuation were 42%. The time to relapse and staying well was significantly longer in patients treated with CBT compared with the control conditions, and relapse was also significantly less likely in depressed youth who were receiving antidepressant continuation as compared to pill placebo over 6 to 12 month follow-up. But relapse rates again were high in both groups, with a relapse rate of 42% in youth who received antidepressant medication continuation as compared to 67% for the control conditions. So I want to highlight this because that's not an insignificant difference, that if you have a relapse rate of 67% in the control condition, but only 42% in patients who received antidepressant medication continuation, that's significant, and it shows the benefit of continuation treatment. But what's still striking is that even in the antidepressant continuation group, although much lower than in those who didn't continue antidepressant medication, relapse rates are not insignificant. They're 42%. So that fits in with what we know about major depressive disorder, that treatment can be helpful, but it's not at the point right now where it needs to be. And relapse, even in those who are treated effectively and continue on the treatment that help get them better, that the risk of relapse still remains high, albeit not as high as in those patients who did not continue medication. Time to relapse was highest when CBT was combined with antidepressant medication continuation. And this is a compelling story that is gaining more and more credibility, that the quickest, the best, the most benefit in terms of reduction in symptoms of depression or anxiety appear to be when cognitive behavior therapy is combined with antidepressant treatment. And now it looks like if you combine or continue CBT with antidepressant medication, that being continued will also improve and decrease risk of relapse, or at the very least, lengthen the time to when a relapse may occur. So what's the bottom line? Relapse prevention strategies clearly significantly reduce the risk of relapse of major depressive disorder in youth by 50%. However, this is a group finding. It still can't be individualized to an individual patient. Combining CBT with antidepressant medication continuation predicted the greatest likelihood of decreasing the likelihood of relapse, time to relapse, and depressive symptoms in youth with major depressive disorder. Unfortunately, there were no studies identified that examined relapse strategies in youth with anxiety disorders, so this is clearly an important area meriting further investigation.